All right. So, all right. So now I will turn the floor over to Miss Janie Griffin.
Okay, thank you, Ms. Demetrius. So we're going to talk about the procedure code search panel. So this is what you all should be utilizing when you're running into the claims that are denying, that's saying that the procedure codes are invalid for the dates of service that you're billing, or you may run across one to where it may say that there's an invalid modifier that's being billed with the procedure code, things of that nature. So we want you all to know where to go to get the correct information, and you'll be able to submit your claims back through. So with that being said, what I'm going to do is walk you through the search for it, and we're going to let you know you can utilize the procedure code description. It talks about, or it shows you the category of service, which is good because sometimes you wonder, well, why is it denying for my place of service when it should be covered? Well, we're going to show you sometimes based on the procedure, yours may not be covered. Okay, so we'll go there. Um, Claim type restrictions, the allowed modifiers, we get a lot of denials with those. So you need to know how you can identify when a modifier is truly valid for the procedure code that you're using. Okay, age restrictions as well. That may be a certain procedure code that you're using that's only for a child, but you're billing a 21-year-old to where the limit may be at the age of 20. Okay, so we're going to show you that. Another thing, the effective and end date for the valid dates of service, as well as if a PA is required. There are some codes that may require an authorization due to it being an inpatient claim. However, if it's an outpatient claim, it may not require that. So we're going to walk through all of that. Okay, so when you're trying to find out about the procedure codes that you're using, first thing you're going to do is go to GAMIS. You're going to select the provider. Then you'll hit the procedure search. Upon you hitting the procedure search, you're going to go down and you will see to where you're going to have to enter your procedure code, the procedure code date, and your place of service. Those are three important things. When you're entering that date, it must be the date that you're doing the procedure. Okay? So if that procedure is a week from now and you know that that member is coming to your facility, then you enter that date in there so you will know if it's valid. Okay, so now you're seeing your place of service on your claim. We got a procedure code in there. When we talked about the authorization, it lets you know whether or not that authorization is required because it does have the PA requirement on there. Okay, so I'm not too good with this, but from there, so when you go down to cover categories of service, and this is what you see on your systems as well. So the category of service, you see 010, 070, 080, and so forth, right? So basically in here right now, I'm assuming the majority of us is either going to be 010 for inpatient, 070 for outpatient, 430 for physicians, things of that nature. So when you're looking at that, you see your category of service, you see your claim type. That claim type means, is it an inpatient? Is it an outpatient? Is it a crossover? All of that is important for you to know. And your modifiers. So when you're looking at that modifier, if that claim denies and says that it's an invalid modifier, and we're going to use the code that we have here, 99213, place of service is 11, and we're going to go down to the 430. So the modifiers that you see are right there within your 430, all of them modifiers. However, right in front of that modifier, you see where it states including 0-4. It may say 0-4, it may say 0-5, whatever. But what that means for you all is If the 0 is there, it's saying that a modifier is not required. However, if you do use a modifier on that claim, the 4 indicates that you can use up to 4 modifiers. But the only modifiers you can use are the modifiers that you see within that panel. So if you're billing with a 52, 59, whatever that modifier is, right, left, if you don't see it on here, it's not valid and your denial is correct. So this is what you will use. And for me, I tell my providers, I'm not clinical, so I can't tell you which one to use. What we do recommend is that you do go back to your medical records department or your charge master department and say, hey, Georgia Medicaid denied the claim saying that that is an invalid modifier. Which one should we use? Okay, and they'll tell you. When we talk about the age, you see where it has the section for the ages as well as the effective dates. And again, if the PA is required. So we just have a couple of examples in here to show you for the inpatient as well as outpatient as well as physicians. So you see your place of service on this one is the same way, the 43259. To where the pre-certification is not covered for the category of service 430 or your place of service 11. But it is required for your inpatient claim and not for the outpatient. Okay, and just want to throw this in there. It's required for your inpatient claim because the majority of your inpatient claims, if it does not pertain to crossovers, or delivery, that authorization is going to be required. Okay, so that's why you see nothing there for the outpatient portion of it. Here again, it's the place of service 11, 43259. You got your dates of service and everything is still the same with that. Okay. So a couple common denials for the PA are the ones that you see listed. If a CPT code is not found in your Appendix E or O in the physician service manual, then there's no PA required. So what do you do as a provider? You will go ahead and submit another claim without that PA because it's not needed. That's a quick, simple fix. Okay. Another one that we run into is members with Medicare A and B as primary. No pre-certification is required. This includes the Medicare Advantage plans. Your Medicare Advantage plans are treated just as your Medicare. Okay, so when you submit those claims over, and if it's a Medicare claim and you're entering the insurance information as United Healthcare or Aetna, but it's an Advantage plan, it's not going to submit over as a crossover. It's coming across as a TPL. And if that's an inpatient claim, it may require an auth. If it's an outpatient, it may require an auth. So that's what you have to remember. The Advantage plans do not require the authorization, so you have to submit them as crossovers. Always go back and look at the type of claim that you're submitting when you run into that issue. Duplicate of PAs. So this occurs when patient had the same related diagnosis at the same facility, okay, and need to make sure that the patient does not meet the 3-day readmit rule. So that's when you're looking to provide the correct discharge date for your admission. I'm sure you all are aware of the 72-hour rule. If you're not, the 72-hour rule is a rule that was created that says if a member is admitted within 72 hours of a discharge date, if it is diagnosis related, those claims have to be combined. Okay, so that's one of the things that they're going into with that as well. The next one is insufficient clinical to review for inpatient admission and procedures. All PA requests must include information to support the procedure and/or the admission. Okay, so sometimes when you're submitting your documentation, you may submit the entire chart. Based on the type of service that you're rendering, your entire chart may not even be required. So look to make sure of what it is that you're submitting over. Okay, and we need for you all to know, if you receive any initial denials and disagree with the determination from Alliant Health, better known as GMCF, you may request a reconsideration. However, there's a time frame for that. Okay, and that time frame says it must be received within 30 days. Day 31, you've lost it. So what does that mean? That means you all have got to be on your P's and Q's when it comes to this type of denial. Okay, well, you need to be on it for all of them. Okay, but this is what happens. All right, and at this time, I'm going to turn it back over to Ms. Anitrius for the remittance advice.
Thank you, Ms. Janie. So for the remittance advice, also RA, you may hear me say RA as an abbreviation. To access your full comprehensive RA, you would need to be logged into your payee account. I get a lot of providers that message me and say, oh, this claim is not on my remittance advice, or I know I built this claim and it's not showing up. That's because they're logging into the individual provider account. If you log into your payee account, it allows you to have access to every provider associated to that payee in your practice, and you'll see the full comprehensive report. How many claims that was billed, how much was paid, was there any recoupments, and so on and so forth. And we'll go through that. So there's a difference, you know, the provider number and then the payee ID number. And if you don't know, if your payee ID number is listed on the top of the remittance device, and I'll show you where it is. All right, so the RA is comprised of a couple of different documents, banner messages. Those are messages from DCH or alerts or notifications, so those are important. We not only publish them under the web portal, under provider information, but we also list them on the remittance advice of the RA as well. Claim activity status, financial transactions, account receivables, EOB descriptions, and I stated the summary page. And the RA is generated every claim cycle. Now, there must be claim activity in order for the RA to generate for that week. All right, so to have access to your RA, again, like the eligibility, you have to have a username and password. And not only that, you have to have permission or been granted permission by administrator to have access to the tab. And as you can see there, reports, and then from the drop-down menu, select financial reports. Now, once you do select financial reports, you see the screen right here in the middle, it asks you the report type. I do want to point out, it says remittance advice, and it's two listed. One says remittance advice, and then one says remittance advice prior to 2010, I believe it says on there. So just make sure that you're selecting the correct one, because it obviously will not pull up your RA if you're looking for 2024 and you put 2010 in there. All right, so then you're going to also put your from and to date of service. I recommend doing a date span. So if you're looking for this week's RA, I normally do like a 7-day window just to kind of make sure that I get that report that I'm looking for. And then you'll click search and all the reports will come up at the bottom, and you'll select and open up that report that you need. And again, log into the payee account so that you can get the full comprehensive report. All right, so here's a screen print of what the RA looks like. And remember, I said that the payee ID number, if you don't know, if this is something new, if you're logged into a rendering account, you can look, the payee ID number is listed at the top. I'm sorry, listed at the top here. And then it also has the payment number or the check number and the issue date, any receiver ID, and the RA number. That's very important as well. And then, of course, the banner message there. All right, so it goes into the claims activity. Like I said, you must have had some type of claim activity in order for the RA to generate. So in this case, it gives us all the information. The ICN is there in red on that side. So you'll see the ICN or the claim number. And then the member ID, the member name, the bill date, if you use the prior authorization, how much did you bill, the from and to date of service, the allowed amount, any copays or deductibles, patient liabilities, if the claim paid and how much did it pay. If you enter the primary insurance, it will be on here as well. So it's very detailed in breaking down what was billed there. And it's good information for you all to have. All right, and then it goes into the financial transactions. If there's any recoupments, take backs, if you all don't know, that's where this will generate here. You'll have an AR number, and also it'll have a setup date, how much we recoup this cycle. Is there any remaining amount that's due? Also the balance, the related ICN that's related to the recoupment will be listed here as well. All right, and then it goes into the financial summary page. On this page, again, when I told you you log into the payee account to get the full comprehensive report, this is what I mean. If you log into the individual account, it won't give you all of this. So under the payee, it gives you how many claims paid for this cycle. How many claims did you bill? How many claims denied? How many claims were in process? Again, was there any recoupments? And if so, how much was taken back, the net earnings. So that's why it's important to log into your payee ID number versus the individual provider account. All right, so now I'm gonna give the floor to Ms. Jane and Greasy for the coming denials.
Oh, no, they didn't. Mm. No, that's what they be saying sometime, right? Oh, no, you didn't. We're going to talk a little bit about some of the NDC denials, okay? And what triggers it. So one of the denial edit codes we received for the NDC codes is 4004, NDC not on file. What triggers it is clearly what is stated. It's triggered because the NDC code that you submitted truly is not one that's on file. You have the 4038, NDC is not valid for the dates of service. 4087, NDC mismatch contract rules, okay? You have your 4891, the submitted NDC is not rebatable. What that basically says is it's not saying that it's not a valid NDC code. That just means that's not one where you're going to receive reimbursement. Okay. And then the last one is the 4889, invalid NDC J code combination. That's not saying that the NDC code you're using is invalid, and it's not saying that the J code you're using is invalid. What it's saying is that they can't be billed together. Okay, so when that triggers, we provide you all with the method of correction. Okay, and that method of correction is just as you see here. Providers can obtain the out-of-package NDCs by the website that we have here. And tomorrow, when you all go back to your offices, print off this presentation so you can have everything you need from what we discussed. Okay, I'm a firm person for my little cheat sheets that I use. Okay. So, and there may be other resources, but the one that we use the most is this one that we're providing you with. So yeah, once upon a time, we were telling you all that you actually could find those NDC codes by utilizing your system on that denied claim line. This is better than that. Okay, it's much easier. It's too much that's on the other one, on the system. So pull that and utilize it. It's great. Or either save it if you have places on your desktop where you can save, you know, your links and everything, do that. We're going to go into the timely filing. I know everybody knows about timely filing, right? You have your 90 days, your 180 days, and your 365 days. So I had a provider that did ask me, well, why did we change all of this? If we're keeping a claim in your system and that claim is constantly running and we're keeping it timely with the denials, then why do you provide us with a limit? That limit is provided to you because honestly, within a year's time, your claim should be processed and paid, right? It shouldn't take longer than that. So that's why that was stipulated. So when you go over there, for most providers, timely filing is 6 months, unless you're an out-of-state provider. That's different. But the majority of you in this room are Georgia peaches. So this is what it is for you. So you have your 6 months from the date of service. Your claims adjustments are 3 months from the month of payment. Okay. Your claims resubmission can be 3 months from the month of your denial. Crossover claims is 12 months from the month of service. Secondaries, TPLs are the same, and then you have that year. And while I'm sitting up here talking to you all, I also want to stress, if there are appeals that you all are doing, you have that 30 days. Okay, voided claims. This is important. And honestly, this was something that we found out about upon a discussion of us trying to create the presentation for you all to inform you of what you really needed to know. So there are claims that process, and they're processing after the time frame. So everything is there. They don't process, they don't pay, but all of a sudden it's like, ooh, Sharita, I forgot to put that ER charge on that claim from 2022. So guess what happened? Provider went out there, they voided the claim from 2022. We in 2024. Do you think you're going to get that reimbursement because you forgot to put that charge on there? That claim is going to deny for timely, and it should. But when it denies, then that's when you do the administrative review. And they're going to tell you the same thing that we have here. Voided claims. Once a claim is voided for payment, any resubmission and or new submission of that claim will be subject to timely filing guidelines. So we all know what that is. Pull this, put it in your cheat sheet, your book. A claim is considered a new claim if there are any changes made to the claim after the initial submission, and that includes total charges, dates of service, revenue codes, things of that nature. If you have a claim that has already processed reimbursement under one revenue code and you forgot that that charge line should have been $350 instead of $35, you can't go back and change that for additional reimbursement, okay? Therefore, the 6 months for the timely filing will apply to the claim that has been edited, regardless if the prior submitted claims were kept timely in the system, because you've already went past all of that. Okay, and just as we say here, this is what we were just talking about, the new system enhancement of it. So I'm not going to go back over all of this because we just did, right? So I'm going to let y'all read that when you get home tomorrow. I mean, get back to work. But to note, a claim that was denied for missing or erroneous information be resubmitted to correct the misinformation within 3 months from the month of the date of service or when the denial occurred, whichever is later. Again, here's our example. And you can always go out there and refer to the Georgia Medicaid Part 1 policy. When I tell you all that Part 1 policy, that hospital services, that physician's manual, that hospice manual, all of that has some very good information in it for you. And I know sometimes we don't want to read because we got other things going on. We just want a quick fix. Go out there and read this stuff. Become familiar with what's there so you can just continue to go through your processing and get your claims to process the way that they're supposed to. I'm a firm believer of when I put it out the first time, I don't want it to come back as a denial. I want it to come back as paid. And I can take that off of my AR. So with what we're stating in reference to timeliness, you can refer to the Medicaid Part 1 Policy and Procedure Manual, Chapter 200. Timely resubmission policy is outlined for you in Section 204. Okay? And at this time, I'm going to give it back to my partner and let her take you all from there.
Thank you, Ms. Shane. All right, so, and so we'll talk about the DMA 520 and the DMA 520A, the documentation that's needed for each. All right, so the DMA 520 is mostly non-medical review edits. Some of the popular ones are no timely filing, possible duplicate, member not eligible. Those are some of the most common ones, I believe. Part B, inpatient, billing rule not found for bill procedure. That comes from not doing a procedure search, you know. But yeah, those are some of the common ones, and that's the list. And we will have this presentation on the web portal tomorrow, I believe, tomorrow, for you all to review and have this list. All right, so only one DMA 520 form can be submitted per inquiry. All fields must be completed. The DMA 520 button, I know you all may be familiar. If you pull a claim up in the GAMIS portal, and then once the claim denies, in the top right corner, you'll see a blue button that says DMA 520. Anybody seen that button before? How many? Yeah, no? Okay, so yeah, if you bill in GAMIS and you do a claim search and you pull that claim up, it'll be in the top right corner. And that's where you would submit that appeal, again, for that list that I just showed you, timely filing, possible duplicate, and things like that. So you will receive a tracking number once you do submit that appeal. Also, for previously submitted inquiries, the status will be provided along with the option to electronically upload supporting documentation. You can include supporting documentation if needed. It can be submitted with the DMA 520. And then if the CTN status is closed, and I believe it's closed after you get your response, because it'll be electronically email form for you to go in and look, you will not be able to upload any supporting documentation. The DMA 520 must be received within 30 days of the denial, and the 520A. So that's for all of the appeals. All right, the DMA 520A is the medical review edits. Those are reviewed by Alliant, or formerly GMCF. You can go in and view those edits under the prior authorization tab, medical review portal. And again, you do have to have access to that by your administrator, just like the eligibility, just like the procedure search. So they will actually give you access to prior authorizations, and you can see this. And then you go to the medical review portal, and then you'll view your edits there. And again, they must be received within 30 days of the denial. And supporting documentation must be included on those appeals. Don't send the whole medical record. All right, so these are, and I know it's small, and we'll have it on the portal, but these are some of the common, or all of the DMA 520A medical review edits. NCCI procedure to procedure, observation greater than 24 hours. Those are some of the multiple surgeries within 2 days. So those are some on the list there. All right, and then rebundled procedure is another one that I see a lot. The abortion procedure code requires certification. No attachments, because they do require attachments. All right, so sterilizations, we do know, like most of these are the documents that's needed for the reviews. Most of them require the operative report, as you can see. Sterilizations require DMA 69. Hysterectomies require the DMA 276. The non-hospice, the DMA 521 or 521A. And these forms are on the web portal under provider information and in forms for providers. So you do have access to that as well. And again, the operative report is required for most of them. So when we say don't send the whole medical record, they're giving you specifics on what to send them. If it's in the whole medical record, I don't believe they review it. I believe they'll deny it and won't review it. All right, so then we do have a 30-day rolling period. Medical documentation is needed for that as well. Podiatry, the office note. And the modifiers listed there, 22, 24, 26, 52, 54, 55, 58, 62, and 78. If you use either one of those modifiers, medical documentation is required. All right, and so the different modifiers are broken down. Again, most of them do require that you upload the operative report, but you can go back and read it. The specific documentation that Alliant is looking for to approve your claim is listed here. All right, so now we'll talk about mass adjustment. All right, mass reprocessing initiated by DCH. You will, if your claim is mass adjusted, you will have 30 days to go in, make your corrections and resubmit that claim. You only have 30 days. And not the whole claim, just the impacted line, not the whole claim. So that, like Ms. Jenny gave an example earlier, you forgot to add the modifier, but that was an impacted line. You can't do that. Only the impacted line. Failure to adjust your claim within 30 days time frame during the DCH enterprise mass reprocessing is not grounds for administrative review, meaning it's not grounds for an appeal on there. This is in Part 1, Policies and Procedures, Chapter 200, Section 204.1. So, for example, if we have code 12345 and we know that January 1st, 2024 requires a modifier, BK, and the claim processed and paid, DCH may go back and say, wait a minute, this wasn't supposed to process without the modifier. You got paid, but wasn't supposed to. They may go back and mass adjust that line item, and then you will have 30 days to go in and add your modifier and resubmit it to make it bill correctly. So that's an example. I mean, it may not necessarily be just that, but that's just an example of what we mean by that. All right, any positive adjustments you can get additional reimbursement possibly. The provider may adjust and resubmit your claim with the documentation. Keep timely filing limits in mind as well. You do have 3 months from the month of payment to add your documentation for your adjustments. If a positive adjustment is warranted, the division will make additional reimbursement upon processing of the request and reviewing that request. If it's not warranted, then you will be notified via your RA. And this information is in chapter 200, section 205. So an example of this would be, let's say you built the primary insurance and they paid $100. Then they come back and say, and then you built Medicaid and we paid up to our allowed amount. The primary comes back and say, hey, wait a minute, we didn't mean to pay it for whatever reason. It shouldn't have been $100. Let's say they say $50. You should be able to adjust your claim, submit that documentation because you would have received a new EOB from them or a remittance device from them, upload it, and then we will review and possibly pay up until our allowed amount. So that will be a positive adjustment because you possibly could be getting more money or reimbursement, should I say, from that claim. All right, so negative adjustments. If you believe a negative adjustment is appropriate, the provider may adjust and resubmit the claim. Just keep timely filing limits in mind as well. This will result in a deduction from your future payment. You may provide a copy of the remittance advice to the benefits recovery section also at the address listed there or upload it to the claim. This is also in chapter 200, section 205. So an example of this probably would be, let's say if you built the claim with 2 units for $200, you do have 90 days from the date of processing to adjust your claim. So, and you meant to be a 1, so you can go in and adjust it, turn it into 1 and change that charge from $100 to $50. Of course, that means you will be owing back because you have billed. You do have 90 days to adjust the claim. And then, so that will be taken from the next reimbursement that you all will receive. So if you did that adjustment today, let's say next week, it will be taken back from the next adjustment. Yeah. Give us a moment here. Thank you all. Okay, claim region codes. The ICN or the claim number that I pointed out earlier on that's on the remittance device, the first two numbers lets us know a lot. That's what we call claim region code. So we're talking about mass adjustments. So I'm gonna start there first. If we see a claim or ICN number that starts with 52, 53, 54, 56, 57, that lets me know that that claim was mass adjusted. If we see a claim with 20, that lets me know that was electronically submitted with no attachments. So when you're telling me your claim number, I automatically know, like, oh, she submitted this web portal, she submitted this to the clearinghouse, or he or she. 22, 23 are web portal claims. So that's how we would determine. So if you're looking at your remittance device and you see a ICN that starts with 52, like I said, one of those that I called out, you know that that was the mass adjusted. Now you can go on the web portal and look at that claim and see why did it get mass adjusted. You can contact your field rep. We'll be more than happy to help you with that recoupment or to see what was going on while the claim was mass adjusted. It may not have been a recoupment, but yes, that's how you would determine if that claim was a mass adjusted. All right, so now I will turn it over to Ms. Sharita Bentley.
Thank you, ladies. Very important information. Good afternoon to everyone again. I'm going to talk to you all about Contact Us. If you need help, have questions, wondering who to call or who your field rep is, you will first call our contact center at 800-766-4456. We're available 7 a.m. to 7 p.m. Eastern Standard Time, Mondays through Friday, except for the state holidays. We also have the Gavi virtual system and the GAMIS web portal, which is available 24/7. The Gavi system, it was formerly known as the IVR system. Here you have 6 options. If you're calling about provider enrollment, that's option 4. If you're calling about claim status, that's option 2. Also, we have the EDI and web portal team. You can get in touch with them at 877-261-8785. They can help you with claim rejections. They can help you with provider PIN activations. They can also help you with enrollment in your trading partners. So make sure you jot down that number. Here's a map of our field territories. They're listed by county. Once you find your county and locate your territory, and then you'll know which territory your county falls under. Once you find out that information, you can find out who your field service representative is. If you're under Territory 3, your field representative is Carolyn Thomas. If you're under Territory 9, your field representative is Kendall Telfar. Make sure that you know that these are your physician field reps. Myself, Sharita Bentley, I am your North Region Hospital rep, and I cover territories 1 through 5. Janie Griffin is your South Region territory rep, and she covers territories 6 through 10. We also have 3 statewide consultants, Sheree Daniels, Brenda Hewlett, and Danny Williams. All right, here's our website. Whenever you want to contact your provider rep, you'll go onto the GAMIS web portal. www.mmis.georgia.gov. Once you've done that, you log in with your username and password. Then you will select web portal. Once you select web portal, you go to contact information and then contact us. Here in the drop down, you can request a provider visit, or you can just contact your provider rep. Make sure where it states, how can we help you? Make sure that you include as much information as possible so we're able to answer your question or concern. Be sure to include the patient's name, the date of service is very important, the Medicaid ID number, and also if you have a claim number, please include that claim ICN number. It's very important. If you're going to use the method of telephone contact, please be sure you're including your extension. If you have a voicemail, please make sure, I know some companies share voicemails. If not, make sure your name is on the voicemail. That helps out a lot as well. to make sure we're leaving a message for the correct person. If you're going to use the email contact method, make sure you have the correct email address. I really prefer email because you can always reference back to that email for the information or the response that we gave you all versus telephone, word of mouth, or whatever. So we really prefer that you use the email method of contact. All right, so you should all know now how to verify Medicaid, Georgia Medicaid member eligibility, perform and understand the procedure search panel, locate and understand your remittance advice, resolve common denials, and how to contact Gainwell Technologies. All right, so we're going to go to questions now. I'm going to come out to the audience first, and then we have Caitlin in the back, and she's going to read off any questions that we have online. So does anyone in the room have any questions? No one? I mean, y'all did really good, ladies. All right, again, remember that the presentation will be available in the morning, so you can pull it. Oh, you do have, okay. Excuse me.
Thank you. So we're with the FQHC, and I was wondering, for a lot of our claims, they come back denied for pre-authorization or pre-cert. Are we required to get pre-cert and pre-authorization with FQHCs?
Yeah, well, it depends on the service. That's where the procedure code panel will come in because it will tell you, your category of service and if that PA is required for the particular services that you are billing. So it just depends on that service. What territory are you in? Metro Atlanta. So if you do have a question or need help, I believe that's Ed DeAndre. You can go in and do a contact us and have her to call you back. But like I said, it really depends on that procedure. And that's with any physician that's billing that you're billing. So if it's telling you that a PA is required, I would recommend that you do that procedure search. And it'll definitely tell you, go there first, and it'll tell you if the procedure code, prior authorization is required. Yeah.
Anyone else have any questions? Going once? All right. Kaylin, do we have any questions online? Contact us. You cannot email us unless we ask you all to email us. That's true. And the reason why is for tracking purposes. We like to make sure that you go through the contact us so we can go back and refer with it, So make sure you use your contact us. We respond. It doesn't take too long. We have 6 business days, but a lot of times, people respond before the 6 business. Are there any more questions, Kaylin? Okay. Yes, we use the CMS. What is addendum B? I think, right, Janie? Yes. Inpatient only, yes. So we do follow the CMS, inpatient only. Inpatient only. And I think it's 2 out there, but B is the one that we usually go by. I think A and B is out there. So make sure you're looking for B when you're looking at it. Is that it? All right, one more time for the room. No one else in the room have a question? All right, well, thank you all so much. and enjoy the remainder of your day.